Now follow and get ready for more. We're setting the stage, so come through the door. Welcome to the show, it's Richie and John. We're talking with Dr. Carlton, get your groove on. From fisting to fucking, oh there's so much more. Sometimes it's fun to behave like a whore. We'll just and rims off, let's talk and explore. With laughs and good vibes, we'll leave you wanting more. Stay safe and smart with PrEP on your side, and DoxyPep to prevent those unwanted rides.
The Mutual Broadcasting System presents Richie and John, the podcast that connects you with the people, events, headlines, and lifestyle interests of the global LGBTQ+ community. Here's Richie Roy and John McMullen.
Welcome to another edition of Richie and John. I'm John McMullen, joining you from Palm Springs. Richie Roy, you're in New Paltz, New York, and we have a very special guest with us this week on our lifestyle episode, which is somebody who's very familiar to a lot of podcast listeners, viewers, and somebody who has garnered a lot of attention around the country because of his role in helping people with their sexual health, and that's Dr. Carlton. He's joining us from San Diego. Thank you for being with us.
Thank you, Richie and John. I appreciate you for having me on the show.
Absolutely. One thing I'd like to start right off the bat with is that Dr. Carlton has agreed that he's going to join us on a recurring basis and come in and talk about issues of sexual health. So we'll remind you, as we always do, that any of the general communication channels that we have, questions that you have, things that you'd like to have answered, you can always send those to us via either our telephone number, which is 24/7, 365, where you can call and leave messages with questions, or you can also send us an email or use the web form that is on the richieandjohn.com website to do that. And in future episodes, we will include your inquiries of Dr. Carlton. So let's begin with, because it's kind of what you're so well known for with a lot of people as a gastroenterologist. You're the butt doc.
Yeah. So that's kind of how I came to the table when it came to social media. So the way I got started with social media was during the pandemic. I am the only provider for my family. I have two children who were in high school at the time, who are now in college. And my husband, a stay-at-home dad at the time. So, I'm on call for the hospital. I go to the intensive care unit for gastrointestinal bleeds all the time, or placing feeding tubes and things like that. And suddenly there's this viral illness that can kill you in the hospital. And, at that point, there was no vaccine. I was absolutely terrified to go to work. I had a lot of anxiety and just major trauma going on, losing people at work, and losing friends and family members of coworkers and stuff who had been infected. So I needed a distraction, and my kids were on TikTok all the time. And I thought, well, there's got to be something to this thing, because they're on it for like 4 or 5 hours a day. So I turned it on one night on my couch, I created an account, and 4 hours later, I looked up at the clock and could not believe 4 hours had passed. And just in a few minutes, the algorithm had figured out that I was gay, that I liked hairy guys, and that I liked older guys. So she had me nailed down pretty fast. And so, I had learned to cook chili. I had learned to, was looking at hot guys, all this stuff within 4 hours, and just kind of got addicted to it. And then I started seeing doctors pop up on TikTok with things like, there's this OBGYN who does a lot of female reproductive health. And, I never saw anybody who did gay health or who did anything related to butt care or butt stuff in general. So I thought, well, here's my chance to get on here and make a splash. Let me make a couple of videos about preparing for anal sex. I'll do it anal sex 1 and 2 and see how things fly. So I got, the opposite of what I am now. I got really stuffy. I had a white coat on. I had my glasses on, I think. And I did a preparation, lubrication, and relaxation video. And then, in TikTok coded language, which is not easy.
Right.
And I think a lot of people were laughing at me because they knew what I was talking about without saying those words. So I put up the videos. I checked my phone really quick, and the first person to respond was a housewife from Iowa who said, "Oh my God, what are you doing putting anal sex videos on a children's app?" You ought to be ashamed of yourself. You ought to delete this immediately and never look at this again. And I highly considered it for about a minute. And then I thought, I can either delete this or I can block her. And
Yeah, which should have
her.
just written back and said, honey, this is actually about prepare your derriere.
So I blocked her. I shut off my phone and I turned on my phone the next day, and there were like 45 or 50,000 followers on 2 videos.
Wow.
And I said, wow, I've really hit something here. And so I just kind of kept rolling with that and caught the attention of a prominent fitness guy named Shaun T, who has his own podcast and a bunch of fitness, the whole fitness industry set up. And he and his husband do a wine night after dark. And so I basically taught him and 300 of his gay and straight clients on behind a paywall one night, all about how to prepare and have great anal sex. And it kind of rolled from there. And I got more and more popular on TikTok, a couple of 100,000 followers after about a year, and then decided I wanted to specialize more into the queer community because TikTok was such coded language and was kind of restrictive, and I was always worried I was going to get kicked off of there because of what I talk about. And I really wanted to focus more on queer health, so I started an Instagram page and built this platform about things like PrEP and PEP and proper STI testing and all the things that I really stand for. And lo and behold, all out of the blue, mpox hit in 2022. And I was watching it from afar. And so I was one of the first people jumping into the scene on it and had studied a lot about it. And I was really the only person who was staying up all night every night for an entire summer, helping people find treatment, helping people cope with their illness, helping people get vaccinated, connecting people in a support group network, teaching people what this is all about. And my Instagram really exploded from that. And, I did it for the love of my community. I also did it because I wanted an end to this plague because we had just gone through COVID for 2 years. So basically no hanky panky, around for a couple of years because I was afraid of that. And then here's this new virus that, threatens us. So, just when we think we're out of the woods, something else pops up.
Dr. Carlton, do you think that experience that we had just gone through COVID and had to deal with all this stuff in other ways for a couple of years, did that actually help to grab people's attention and to help them take it as seriously as it needed to be taken?
I think so in some ways. I mean, yeah, there was a lot of COVID fatigue, which was a problem because a lot of people just didn't want to hear about being restricted on their sex life anymore.
Right.
But we had seen what a virus could do to decimate our population really fast with COVID. And then, our community has had to fight for itself for decades on HIV and AIDS. So we're kind of used to this kind of thing, especially things that are aimed at us, like this mpox thing seemed to be.
Right.
So I think that we came together as a community. We really fought for each other. We were telling each other about where to get vaccinated, about how to get treatment, and about the latest studies and the do's and don'ts. There was a study that came out that said 50% of new cases were from one-time anonymous hookups. People stopped hooking up anonymously. So 50% of people stopped doing that and got vaccinated. And then we dropped the pandemic. We dropped the numbers from 32,000 infections in 2022 to 325 in 2023. Now that started to creep back up again this year a little bit, but not nearly to the amount that we had in 2022.
Let me ask you about that for a second, because Richie and I, we have a really good friend who, of course, went through getting vaccinated for that. And earlier this year actually had a bout with it. And I think that there's a lot of people who have the idea that once I am treated for this, I'm good to go and I'm not going to get it. And yet people are getting it again.
You mean they're getting vaccinated and then they're getting
And then
Mpox.
they're getting Mpox. Yeah.
Yeah.
So
I mean,
what?
no vaccine is 100% effective.
Yeah.
No vaccine is. So I think that's a huge misconception among people, thinking that they're going to get a silver bullet with this vaccination.
Okay.
It is 86% effective with 2 shots, though. So that's pretty remarkable.
Right.
And usually if you do get infected and you've had both shots, your case is a lot less severe than if you had not been vaccinated. So there's that dramatic improvement in infection rate, and then there's that dramatic drop in the severity of your infection. So yeah, there's nothing that's a silver bullet for this, but it sure as hell is better than not being vaccinated at all.
Of course.
Yeah. And a lot of people are confused by that. You're right. Hey, I got vaccinated. Why am I getting infected? Well, you got vaccinated for COVID and you got COVID, or you got vaccinated for the flu and you got the flu,
So
but I think that just stepping back a little bit, there's a lot of, I think what you're doing is really important, because the literacy level for gay and queer sexual health can be remarkably low, because I live in the Hudson Valley. It's 2 hours north of New York City, but I've had a primary care physician who is gay tell me, why do you want to be on PrEP? Just use condoms. I've looked for monkeypox vaccines up here, and they are impossible to get. DoxyPep is something that I managed to get through Mister, but could not get, through local providers. So there's a huge chasm between what we know works and what a lot of people's experience of sexual health is like right now.
Absolutely. And there's a huge disparity across the country in that. And there's a lot of bad literacy, even in gay physicians sometimes, on what you should do and what you shouldn't do. I actually went, with all this Mpox stuff, after being recognized by Out Magazine and their Out 100 and Queerty and their Pride 50, I got invited to the White House. I went to the White House 2 years in a row for their Pride celebration. And in 2023, I actually got to sit down in the Department of Health and Human Services with the highest ranking trans official in the country right now, Dr. Rachel Levine, and her assistant, and talk about what I thought was important for my queer health agenda. And in 2023, the 2 things that I had at the top of my list were anal pap smears for people who are at risk for anal cancer. If you have HPV and HIV, there's a 70 times increased risk for anal cancer. So you should get an anal swab done every year starting at age 35 if you're HIV positive. So not many people do those. Not many people even know about it. And so that's one of the first things I laid out on the line on my agenda. The second thing was DoxyPep and how important I thought that was because of the dramatic reductions in STIs that we saw with that. So I said, this is another part of my passion. I've been talking about this for 3 years, and it still wasn't in the CDC guidelines at that point. I said, I really want to see something in the CDC guidelines, so that, because a lot of doctors, their patients would hear me talk about it and they would run to their doctor, and their doctor said, hell no, I'm not doing that because there's no official guideline on it. So it's just going to create resistance or whatever. So I really pushed for that. Hey, listen, we have a chance to knock down our STI rates big time in our community with this. And lo and behold, I went back to the White House in June, and both of those top 2 things have been handled by the CDC and the National Institute of Health. I don't know how long that's going to last, though, with this upcoming change. But I did go in there and fight for queer health. And the other thing I talked about was proper STI testing and how that's just not done across the country as like it should be either. So there is a disparity. You're absolutely correct. And a lot of first of all, a lot of doctors are poorly educated on queer health because there's just not a lot of med school classes on that. Thankfully, I just got contacted by Tulane University, and they're going to have a queer health thing that the students are doing on their own on the side, and they want me to do one of their classes next month in January. So I'm going to do that for them, just because I think that stuff's important for doctors to know. And I've done it for National Colorectal Surgeon Group too, just so that they have no idea that we fist and what fisting's all about. So they need, a colorectal surgeon who takes care of all the accidents that happen needs to know that stuff. So I, laid it all out on the line, completely uncensored as to what's going on with all that. So
good.
So those sorts of things, there is a huge gap in our knowledge amongst physicians, but there are organizations that are trying to help fight that. The Gay and Lesbian Medical Association is one of those. They have a directory nationwide of providers that are LGBTQ friendly on their website. You can put in your zip code and you can try to find a provider but not all gay providers are listed, but some are. And if you're a gay provider and you're not on that, please put yourself on that list so that people can find you, because people want you.
Yeah, I remember that Richie and I were trying to help a friend of ours in Texas almost 2 years ago, I guess, and to find a physician who would be able to help them and who would be understanding, empathetic, and knowledgeable about health issues that they needed to have addressed. And it was surprising to me, because that was the first thing I did, was go to the GLMA website. It was actually kind of disgusting to me how many people, or how many places where you couldn't find healthcare providers who were at least friendly towards that kind of treatment and practice. But it is a great resource for finding places to actually see doctors or specialists that you need, who do understand where we're coming from.
Yeah, for sure. Yeah, so the literacy of providers is important. I had a friend who said he moved from Florida to Arizona, and he was in medical training, and he had gone for his first 2 years in Florida and was going into the second 2 years in Arizona. And he found a new doctor, and this new doctor was 74 years old. And he walked in the door and said, the doctor said, "What's your medication list?" And he goes, "Well, Truvada." And he goes, "Oh, you're HIV positive." And he goes, "No, I take it to prevent HIV." And the doctor just put his hands in his head, hand on his head, and tilted down and said, "I don't think I can take care of you." I've never heard of that.
Wow.
So, I mean, there's a shocking lack of knowledge, but I guess at the same time, this guy was doing him a favor. He didn't understand what was happening, so it's probably better to be with someone who knows what's happening.
Sounds like he took the hypocrite oath.
Yeah, I mean, so we have a lot of catching up to do to teach our physicians about what's going on with us. You really do need somebody who understands you, or they don't have to be gay or lesbian or bi or trans or queer, but they need to know and be friendly with those, or at least facilitating to those these patients, so that we get what we need.
Yeah.
We talked briefly earlier about STI testing. I tell people, the traditional way for STI testing is you go in for a P test and a blood test. A blood test checks for HIV and hepatitis and syphilis, and then your P test is supposed to be gonorrhea and chlamydia. But if you perform oral sex, you have to have a throat swab done to check for gonorrhea and chlamydia in your throat. And if you bottom, you have to have one of your rectum to rule out gonorrhea and chlamydia of your rectum, because I can't tell you how many friends and patients of mine have been positive in one of the three places, but not all three. And if they had not gotten those swabs done, they could have propagated that infection through the community by continuing to do what they did when only their urine was checked and it wasn't positive. So I tell people, get all your holes checked when you go.
For sure. I've been fortunate enough here in Palm Springs to, over the almost 20 years that I've been here, have two primary care physicians, both of whom were gay themselves, and who definitely
that's
were.
Palm Springs. I mean, you're lucky. I mean, if you can't find a gay doctor in Palm Springs or San Francisco or San Diego or New York or LA or Miami or Seattle or Portland, I mean, they're everywhere there, those places. But Alabama, Mississippi, parts of Texas, Missouri, who knows?
And I think that's why we share with friends of ours who are elsewhere around the country the education that we get from those physicians, and at least get our friends to question their physicians when they don't necessarily have people who are educated on that, to ask them these questions about those kinds of things, so that at the very least they kind of know who and what they're dealing with in their own neck of the woods. But do Do you think that we become so used to, in the age of COVID-19, doing a lot of telemedicine? Do you think that that is one way to overcome some of that geographic issue?
I agree. There to an extent, when it comes to geographic issues like that, telemedicine is great, but because of COVID-19 not being as prominent as it was, a lot of insurances aren't paying for telemedicine anymore. So if they would pay for telemedicine, great. Yeah, that's a good way to do it. But also, you can't really be examined by a doctor properly over a video call.
Right.
So, and then, the trick of like doing your labs properly, getting the throat swab and the rectal swab and the blood and the urine test.
Yeah.
That might be a little bit difficult to find a lab who understands what's going on as well. But it's definitely.
I'm just thinking about people who might be living out in buttfuck Texas.
Yeah.
Who,
well, I mean, that's, you mentioned you get your stuff through Mister. That's one of the reasons why companies like that are important, I think, because they provide those, things like PrEP and PEP and DoxyPep to people who otherwise not be able to get it. They also have big flashy storefronts in Hell's Kitchen and West Hollywood, so they're making some serious money off of it.
They are. I mean, but
they're sending all these guys in flashy little bikinis with muscles to all these different events. So they're definitely making a ton of money, and then they're coming to people like me to ask me to do videos. And when I ask, well, okay, how are you going to reimburse me? And it's like pennies. I'm like, are you kidding me?
Right.
Yeah.
But one of the things I think is important that you're doing, because we're talking right now kind of about the eat your vegetables part of it. The doctors, the kind of PEP and PrEP and stuff. That's the kind of like preventative medical side. But pairing that with the fun part, with the how to make sex fun and pleasurable part, I think that's important to have both at the same time, because otherwise, like you mentioned, COVID fatigue, there's also just kind of like hygiene fatigue. But if you're pairing it with a message of you're not only going to be sexually well, but sexually enjoyable, that's a good pairing to have.
Yeah, no. And like people are like, I got a question on Blue Sky today. If I'm going to rim a guy, what can I do afterwards to decrease my risk for infection? And I'm like, well, a good swig of Listerine and swish it around isn't a bad way to end things, but a good way to start things is start in the shower and get it clean, like you're washing a piece of fruit. You're not going to bite into that until you clean it off, probably. So, start in the shower. It's still hot. It's still great. But that's one way to decrease infection risk.
I've never washed peaches with so much joy in my life.
I know, right? Yeah, I know. That's so. These things are. There's a way to get the message across in a fun way, in a lighthearted way, and even a little bit of salacious way, but get the message across.
Yeah,
that's what I do.
And I think it's important to do it that way. I know, for instance, like even the CDC, for things like Shigella, they do targeted messaging towards the LGBTQ community that is a little more salacious, a little more fun, catches your attention, because if it's just strictly, if it's medical, if it seems punitive and unfun, people will tune it out. People don't want to hear unfun things.
Right. Yeah. And that's, that's true. And that's one of the things that I had to be careful about, because for the longest time, I was this harbinger of terrible news about mpox. And people probably started getting really annoyed with seeing me come on again to talk about something. So, I had to mix it up and keep it lighthearted and try to be creative about it. Hey, we can, create a sex pod of people that you're having sex with, so that none of you get out of the pod and screw around with other people, and that way you keep each other safe until you all get vaccinated.
Well, let me tell you, if there's one thing in the world that is unfun, it's Shigella, and I had it many years ago, and I seriously just wanted to die.
Yeah. And a lot of people, it shuts off a lot of people from ever wanting to do that again, because of the.
Well, let's not go that far, but.
So definitely, there's there are risks with anything you do, but my whole spiel is harm reduction. Life is short. We're in an age now where we have PrEP to prevent HIV, and it's over 99% effective when taken properly. I have one guy call me on Instagram in a panic on a Sunday morning. I always get the Sunday morning messages or calls from, frantic calls. Oh my God, last night I had sex with a guy and we didn't use a condom and he orgasmed in my butt and I don't know what to do. And do you think I should get on PEP? And I'm like, well, yeah, you should definitely get on PEP if you don't know his HIV status. And then once you get done with PEP for 28 days, which is basically PrEP plus one other HIV medicine, go on PrEP to prevent HIV. And he goes, oh, well, I already have PrEP. It's just in my cabinet. And I'm like, well, it doesn't work by Bluetooth, honey. You have to actually take it. So I think that I think a lot of us have the tools and we still don't follow.
Why do you suppose that is?
Yeah.
And one question I have about that, because I know that, so PrEP, the kind that you take every day, that makes sense to me. But then the thing that complicated it to me that I didn't understand, that there seems to kind of be out there, is this kind of thing called disco PrEP, or basically 24 hours before plus 2 days. And that didn't seem to me like that. I don't understand that, and like it doesn't seem very clearly messaged to me. But
and you're right. It has to be very clearly messaged and very closely followed. The San Francisco AIDS Foundation website has an amazing section on 211 PrEP for the exact instructions on everything that you need to do and all the do's and don'ts when it comes to 211 to make sure that it's right for you, and that you do it properly and that you don't mess it up, because this is one of those things where you have to follow the timeline on it very carefully, and you have to use the right medicine. You have to use Truvada and not Descovy. Descovy's lower dose. It doesn't get that high dose to the tissues as quick enough as you need as Truvada. So you take 2 of the Truvada strength pills within 2 to 24 hours prior to sexual encounter. That floods those that drug to the anal tissues in time, so that and the urethral tissues in time, so that if you get exposed to HIV, there's enough there to fight it off. And then you take 24 hours after the first 2 pills you took, and then 24 hours after that pill, so that you've taken at least 2 pills after sex on that 24 timeline. And if you continue to have sex through the weekend, like, if you keep going on that 1 and 1 until you've had 2 after your final sexual encounter. So, but that has to be followed very carefully. It can't be the lower dose. It's not for people with a vagina who are having vaginal sex, because the vaginal tissues don't accumulate the drug in high enough of a dose. It's not for people who are positive for hepatitis B, because one of the medications in there is a medication to treat hepatitis B. And if you go off and on and off and on and off and on, this medication is going to screw up your hepatitis B. So there's a whole list of things on the sfaids.org page that's really, really good to follow that. It is really effective. It's not quite as effective as daily dose PrEP. But it's also probably safer on your kidneys and your bones. Truvada at full dose can damage your kidneys, can damage your bones. I have friends who have the bone density of their grandmother because they were on Truvada forever and never got their bone density checked. And there's actually a lawsuit against Gilead about that. They knew that Descovy for a long time, allegedly knew that Descovy for a long time was equally as effective against HIV for PrEP as Truvada, but they didn't release Descovy for a while. And now Descovy doesn't have that effect on the kidneys and on the bones, but it can raise your triglycerides. But they still check your kidney function along with your STI testing every 3 months. So so you got your daily pills, you got your on-demand dosing. You could even do on-demand in such a way where if you only have sex when you go to Provincetown for a week, you could start a week before, do it while you're there, and then the week after. And then if you're not going to have sex again for 6 months or whatever, then just don't take it anymore for a while. Because that's just how some people are. It takes a lot of planning for sex. I like the spontaneity of being gay and being at the gym and, something might happen. So I like the daily prep thing. The hottest new thing, though, is the injectable prep. You don't have to worry about missing a pill.
Yep.
You get injected in the doctor's office every 2 months. It's 100% effective. And a new study in Africa and cisgendered women for a 6-month injection found 100% effectiveness.
Wow, that's great.
So things are really, really rolling along with prep. That shot is painful, though. The first dose is literally a pain in your ass for about a week.
Wow.
But then you get used to it, apparently. But that first dose is a humdinger.
When you say pain in the ass, is it kind of like taking a tetanus shot?
Yeah, but a lot worse. Yeah.
Wow.
Yeah, in the butt. Yeah. Yeah. So just anecdotal reports from friends, a lot of them have been saying that first one's a humdinger, but after that it gets better. But then you don't have to worry about taking a pill and you're protected, and it's just amazing. So we really have come a long way in our preventive realm. And then obviously if you are, my first pillar of sexual health is knowing your HIV status. And as we come to World AIDS Day this week, on the 1st, not sure when this is airing, but we're right here in the beginning of it, is that, know your status. If you're negative and you have risk factors for HIV infection, get on PrEP to prevent it. If you're positive, get treated to undetectable. You can't pass the virus through sex and can live a completely normal life. There's no reason to discriminate against someone who's HIV positive because you can't transmit the virus through sex if you're undetectable. And most people who are positive and are taking their medications are on top of their health so hard, compared to some random dude on Grindr who doesn't even know his status and says, oh yeah, I'm HIV negative. So you're probably a lot better off and a lot safer with someone who knows their status and is undetectable and taking medications than someone who doesn't know their status at all if you're going to have unprotected sex. So that's the first pillar. The second pillar is what we talked about earlier with getting your STI tests properly done and getting all your holes checked. Thirdly, vaccines. Get those vaccines that we need in our community. You've got Hep A and B. A is spread through rimming. B is spread through blood and body fluids, just like HIV. Most of us have been vaccinated for both of them. For B, your antibody titers can drop over time. You should get those rechecked after about 10 years from your last shot, just to make sure you have enough to fight off an infection if one should come around. Hepatitis B can cause cirrhosis and liver cancer. So you want to make sure that you do the simple thing of getting your titers checked. HPV is now up to available for people up to age 45 and covered by insurance. After 45, you can get it out of pocket if you think you're a good candidate for that. But that prevents anal cancer, throat cancer, cervical cancer, and people with a vagina. So that's another big one. And then lastly, the meningitis vaccine, another big vaccine that is, especially if you're HIV positive, there are outbreaks and clusters because of the way we kind of congregate and hang out in the gay community that about every 5 years, you'll see 10 or 12 people in a group cluster somewhere die of meningitis. Like we had one in Florida a couple of years ago. Before that, it was like Chicago, LA, New York has had a cluster over the last 10, 20 years. So that's an easy thing to fight off with a vaccine as well. And then last but not least, the mpox vaccine, if you can find it, depending on where you are, make sure you've had both doses of that.
Yeah.
So those are big things that you can do. And then when it comes to playtime, inspect the merchandise. If it doesn't look or smell right, then don't play.
Right.
And then lastly, like you talked about, Richie, earlier about DoxyPep. DoxyPep is really the latest, hottest thing. DoxyPep is 200 milligrams of doxycycline within 24 to 72 hours after a high-risk exposure. It's kind of like a morning after pill for sex to fight off bacterial STIs. So there is a 78% reduction in syphilis rates, a 69% reduction in chlamydia infection with it in studies, and then much less so on gonorrhea, but some drop in gonorrhea. Doxycycline is used to treat chlamydia and used to treat syphilis, but not really used to treat gonorrhea. So the gonorrhea thing is kind of an interesting finding that's happening with this because it's not something we usually use to treat it with. The number one worry for all these people who are concerned about it is resistance. A lot of people are like, oh, I've always I've always heard that if you take an antibiotic, you should take a full dose of it, and you should you should use antibiotics very sparingly so that you don't build up resistance to infections and stuff like that. Well, Doxy is one of those that has very minimal resistance right now. It's been used in skin conditions like acne and rosacea for decades in some people. The worst side effects are diarrhea and nausea when you take, so you have to kind of take it with food, and you have to avoid dairy products. Sun sensitivity also is another thing. So unfortunately, if you're going away for like a gay cruise or something, you better wear a hat and a lot of sunscreen. You can take Doxy. And the proper way to take it within 24 to 72 hours after high risk exposure, you go to the bathhouse on Saturday night, you hook up with 10 or 15 guys, you come home the next morning, you take your 2 DoxyPep, or before you go to bed, take 2 DoxyPep. And then those numbers decrease. Now, the risk benefit ratio really is something that I think about a lot in medicine. And if we have a chance to really drop our STI infection rates by 70% for bacterial STIs, then the incredible impact that can make on our community at dropping our overall burden of STIs is far outweighing the risk of a resistance to Doxy right now. Now, they're monitoring all this because so many people are concerned about it. They're monitoring to see if any of this changes. If we start to see a change in that, then obviously this whole thing will change as far as a recommendation. But right now, the CDC guidelines are, and it's in the CDC guidelines, if your doctors are giving you crap about it, point it out. It's in my link on my Instagram page, on my link tree. The guidelines are in there, so you can point it out to them. Hey, well, the CDC says this, so why aren't you doing this? DoxyPep is a really big additional player to bring us back to that mindset of the 70s. Like I missed out on all that good stuff because I grew up in the 80s and 90s and I was terrified I was going to die from having sex. So now we've got pills to prevent HIV. We've got pills to prevent STIs. Obviously condoms are the safest way to go, obviously, but not a lot of people are using them anymore. So, and for a number of reasons, some people just don't like them. Some people don't have, especially as I get older, it's harder to stay hard with a condom on. Definitely I encourage condom use if it's something you're okay with and you want to do that, because that definitely will prevent all the other STIs. But PrEP is actually more effective at preventing HIV than condoms because of breakage risk.
We have covered a lot of ground tonight, and I really look forward, because there's a whole bunch of places that we can jump off and have a much greater conversation on a whole bunch of different topics. And I can think of 10 more questions I want to ask right now.
Well,
but we're almost
going to do this a lot, so
we're almost out of time. But I do want to make sure that people know how to find you. So I think one of the best resources we can give them, and we'll include this on the website this week as well, and in the show description notes, but is your link tree. And that is linktr.ee/Dr. Carlton, DoCtorCarlton. And again, we'll have that on there. You can also listen to the podcast, But Honestly, at Apple and Spotify, Amazon, and a couple of the other services as well. But since you're listening or seeing us, we know that you're at least on one of those. And so you're going to be able to find Dr. Carlton right here as well. Just search for the show. And again, that program is called But Honestly, BUTT, HONESTLY. Dr. Carlton, thank you so much for hanging out with us and educating us and keeping us alive and happy.
Well, thank you so much for all you do. And being a podcaster myself lately, in the last 21 weeks, I see how much work goes into podcasting. So I thank you and applaud you for all the shows that you guys have done.
Well, thank you.
Thanks.
And we will look forward to visiting with all of you again. We'll be back with Newsday Tuesday this week. So we're looking forward to doing that and hope that you have a great rest of your holiday weekend. If you're in the United States and been celebrating Thanksgiving, we hope that you got stuffed somehow and or ate some stuffing, something like that. And we'll continue our conversations here on Richie and John as we always do. You can find all of our contact information at richieandjohn.com. That's RICHIEANDJOHN.com. And Richie, hope you have a great week as well.
Thanks. Talk to you soon.
Thank you for joining us on Richie and John. This podcast is a production of the Mutual Broadcasting System and is available at richieandjohn.com, as well as most major podcast portals, including Apple Podcasts, Amazon Music, and Spotify.